The biggest mistake that I see people making when trying to solve their knee pain long term is only focusing on half of the rehab process, okay? And this is mainly important when your pain is stemming from the knee joint, okay? Not necessarily the muscle or the tendon, but the joint. So around the kneecap or the back of the kneecap or between the thigh bone and the shin bone. Maybe you have meniscal issues, cartilage issues, osteoarthritis, for example. So two things you need to focus on is number one, you need to calm the knee down first. You need to clean up the internal environment of that knee. And then you need to rebuild the knee by working on strengthening and endurance strategies. Okay, so what do I mean by calming the knee down first? So if your knee is swollen, if it's stiff, if it's irritated or painful, it's much harder to strengthen that knee effectively and strengthen the muscles and shift the stress from the joint into the muscles. So before you ask the knee to do more, you need to create a better internal environment inside the joint to be able to respond to the strengthening and endurance exercises. And that might mean starting with very gentle knee movement and using specific tools to reduce stiffness and reduce swelling inside the knee. It might mean modifying the way that you do things day to day to avoid constantly irritating the knee. It may involve, specific sleeping positions to make sure that you're not in experiencing pain at night. It might involve managing flare-ups and more. You have to think of this as preparing the foundation before you start building, okay? And here is where many people get stuck. They spend weeks and weeks and months even trying to calm the knee down, but they never actually focus on rebuilding it. And you could even, think about steroid injections and other injections that people try to use to try and calm things down inside the knee joint. Like a steroid injection, a cortisone injection, for example, can calm things down, but they never actually try to rebuild things. They think that that's the thing that's going to fix it. Okay, so you need to calm the knee down first, but that's only half of the rehab process. That's where you have to strengthen the muscles and build endurance in the muscles around the knee to start shifting the stress away from the joint and into the muscles. This is where your quad muscles, your calf muscles, your hamstrings, your glutes are really important. Those are your knee joints support system. So the stronger, the more they can handle stress and pressure, the better your knee can tolerate walking, stairs, running, squatting in everyday life. Okay, so you wouldn't necessarily choose one or the other. You've got to calm the knee down first, but if you only try to calm down the knee, it never becomes stronger and you never are able to shift that stress into the muscles. And if you only strengthen an angry knee, it's going to push back. It's not going to respond to those strength and endurance focus strategies. So the best rehab does both. You've got to calm the knee first, and then you rebuild the knee into a stronger, more resilient knee that's ready for all those activities that you want to get back to.